Welcome back, everyone. We will now start our second panel discussion, which will be on mental health. It will be moderated by Dr. Cindy Maxwell, her Vice President of Medical Affairs and System Transformation and Lead Medical Executive at Women's College Hospital. Our panelists are Bonnie Hill, Registered Psychotherapy, Education Coordinator for Psychotherapy Trauma Therapy Program at Women's College Hospital. Dr. Crystal Clark, Associate Head of Research, Department of Psychiatry at Women's College Hospital, and Associate Professor, Department of Psychiatry, University of Toronto. Khalilah Elliott is a cancer survivor patient, and Luana Pereira is a social worker and psychotherapist specialized in psychosocial oncology at the Peter Gilgan Center for Women's Cancers at Women's College Hospital. It is my pleasure to introduce our second panel on mental health.
Breast cancer does not have to be a death sentence. I'm a recovering perfectionist, a self-control freak, and a people pleaser. I like to be in control, I like things to be done my way, and I like people to like me while I'm being perfect and in control. So when I ran my fingers through my hair and a huge chunk came out, I decided it was time to control what I could and shave my hair, and my husband Jason was the man for the job. My heart was beating fast, my hands got clammy, and I started to mask my fear with a familiar silly giggle. We stood in front of the mirror side by side, and he turned the shaver on. I didn't know at that time how attached I was to my hair until I saw it all over the floor. I've had many haircuts, but this one was different. I was smiling, but I felt like crying. Jason said something funny to take my mind off it, but I know he was just as scared as I was. When he was done, he handed me the shaver and said, "Now, do mine. We're going to be triplets today, you, me, and our son." I knew breast cancer ran in my family. Both my grandfather's sisters had breast cancer. One passed away in her 30s and one had a mastectomy and lived to be in her 90s. The cancer experiences of my great aunties were not talked about, so I didn't know much about it. So when I found a lump in my breast, I wasn't rushing to get it checked. But thank God I listened to Jason and got a mammogram and ultrasound, which led to a biopsy. I went to do the biopsy alone, not knowing what was about to happen. I looked around in the waiting room, and all I saw were older women. And I thought to myself, why am I here? I'm too young to be here. I was only 39. A few days later, the call came that my results were in. "Don't come alone," she said. This was the first moment I felt panic and fear. Jason came with me that day, and as we walked in, he held my hands. "You scared?" he asked. "Yes, a little," I said. "It's cancer," were the only words I heard, and everything became an instant haze. I started to cry. No, I bawled. The doctor was crying, the nurse was crying, Jason was holding me. I was shattered. But then I heard the doctor say, "The survival rate for this treatment plan is 88%. This is not a death sentence. We are going to focus on surviving." After a few days, we told the kids. I didn't know what they knew about cancer. It wasn't discussed in our home either. My daughter was 12 and my son was 5. My son didn't understand, but my daughter asked, "Mom, are you going to die?" That punched me in the heart and took my breath away, and I wanted to erase those thoughts from her head instantly. In that moment, when I answered my daughter and told her, "No, I'm not going to die," I decided to focus on living. As a mom and a wife, I never put myself first, but now I had to. I allowed myself to release some of the control because I realized this fight for my life was in God's hands. I couldn't control anything about me getting cancer. I had to let go and let God and the doctor take care of me. The Bible says laughter is good medicine, and whatever you think of, that's what you become. So I chose to laugh often. I watched comedies, I listened to music on full blast, and I even took a bath. And I'm a shower girl. When I lost all my hair, including my eyebrows and eyelashes, I chose to find a new fashion sense. I wore head wraps and put on makeup, and I'm not a makeup girl either, but it made me feel pretty, and my friends even said I was glowing. Cancer has taught me the importance of community, a strong support system, and a positive mindset. I now know that I can overcome anything through Jesus Christ. He is my strength. My journey has ignited a passion in me to speak out and share my story, to remove the stigma of cancer in the Caribbean and Black culture so women will no longer fight this battle in silence. When we don't share our history and lived experiences, we miss the opportunity to help shape the future. We need each other. We were never meant to walk this journey alone. When we support each other, our healing is much more powerful and life-changing. Breast cancer does not have to be a death sentence.
Hello, everyone. I'm Cindy Maxwell. As you are aware, there is stigma, myth, and misconception related to mental health in the Black community. And for these reasons, as well as mistrust, the lack of Black mental health care providers, and for other reasons as well, Black women in need of mental health care often hesitate to reach out to receive support. Data reports tell us that members of the Black community are less likely to access mental health services compared to other racial groups. So tonight, with the help of our panelists, we hope to shed light on these issues and discuss strategies to identify and improve mental health support for Black women. I believe that you've heard the introduction of our panelists in the comments by Elaine just prior to the very moving and powerful video that we just heard. And so to start us off, I will turn to Dr. Crystal Clark. Crystal, I have the first question for you. And the question is, what is mental health?
Well, thank you, Dr. Maxwell, for that question, which is so important to this discussion tonight. What is mental health? So we all need mental health. Mental health is our social, psychological, and emotional well-being. The World Health Organization defines it as what it takes to have to deal with life stressors, daily life stressors, those curveballs that get thrown at us, to contribute to our communities, to live well, to learn, to play well with others. That is mental health. And when it is impacted, this thing that's integral to our entire well-being, when it's impacted, it impacts our ability to take care of ourselves, to contribute to our society, to work, to function. And that can be detrimental.
That's so intriguing. Can you say a bit about the signs and symptoms that people should be concerned about?
Yeah, so when our mental health is impacted by mental illness, what we most commonly are talking about are symptoms of depression and anxiety, because that's what we most commonly understand and see and what's most prevalent in society. When we're talking about depression, for instance, those who are depressed, when the symptoms are clinically relevant, not just, having a bad day. We all have bad days. We all have good days. We all have those days where we're a little anxious and stressed out. But when it becomes clinical, it's usually because these symptoms have become majority of what we're feeling over a 2-week period or longer. In most cases, it's longer, especially in the Black community, especially among Black women who have ignored it for a long time, trying to fight their way through it. And when we're talking about depression, we're talking about symptoms of lack of appetite or eating our emotions, that carb craving that just won't seem to go away. We're talking about sleep disturbance. So that sleep disturbance can look like excessively sleeping or not sleeping at all, like go toss and turn all night and get up still just as tired as when you went to sleep. We're talking about, feeling hopeless and feeling like I can't do enough. I'm not good enough. Feeling worthless. Feeling just like tomorrow is just never going to get better. And then in some scenarios, people also start to feel like I don't want to live, or I might even want to take my life because this is just so painful, so unbearable. And those symptoms can go on. Usually people are experiencing multiple symptoms. It's not just one, it's usually a few. And of course, the major symptom of depression is just ongoing sadness or lack of interest or ability to enjoy things you once enjoyed, enjoy relationships you once enjoyed. When we're thinking about anxiety, it's a little different. It's just that ongoing fearfulness, stressed out, catastrophizing, like something bad is going to happen even when there's no signs that something bad is going to happen, or even if there is a sign. We're talking about cancer tonight. It's like, okay, this is a diagnosis, but maybe the prognosis, like we heard about in the story we just heard, maybe the prognosis is, oh, actually 88% do really well, but the anxiety will be like, I'm dying tomorrow and I'm planning my funeral. So, just anxiety or worry out of proportion to the circumstances can be quite significant and impairing, and that's when it's clinical. And of course, in our community, there's a lot of functional depression and anxiety, unfortunately, but that does not mean that it's not getting worse and impacting us more and more psychologically as time goes on and putting us more at risk of just suffering or getting to a point where suicidal thoughts kick in or suicidal attempts happen.
Absolutely. You've touched on anxiety, depression, I suppose post-traumatic stress disorders also in the picture. Do all Black women face similar mental health symptoms when diagnosed with cancer in particular? And are there additional challenges that they might face with regard to mental health?
Yeah, this is a great question. I want to first start by answering this question by just kind of level setting here in terms of cancer and mental health in general. So number one, there's an increased, almost triple the rate of depression and anxiety in cancer patients. When you add on gender, those who identify as women have an increased risk of cancer, especially for cancers like lung cancer. So, they're already at increased risk. When you add on Black women, being a Black female with cancer, now we're talking about other factors that also increase the risk. So what might those factors be? We're talking about guilt. We heard someone say earlier in this presentation, just blaming self for the illness, having cancer. Not that it's anyone's fault, but Black women disproportionately take that on as their personal burden that they did to themselves, which is not true. So it's actually been shown that guilt itself and how the narrative you tell yourself mentally can increase the risk of depression and anxiety. There's also the stigma associated with that guilt, but also with mental illness that makes Black women less likely to seek care. But also trauma. You mentioned trauma, and trauma disproportionately affects the Black community, and those who have had a history of trauma have a higher rate of having depression or anxiety in the context of a cancer diagnosis, especially because of things that if they've been sexually assaulted, for example, having breast cancer, having someone constantly performing breast exams and other exams like that could be re-traumatizing. And so there's a lot of anxiety or PTSD recurrence and depression in that context that disproportionately impacts Black women.
Thank you so much for that response. One last question for the moment, Crystal. When dealing with mental health and cancer diagnoses, we know that having a dedicated support system is really important. What recommendations would you give to women regarding having that proper support in place when you're going through these kinds of challenges, and what might that support look like?
Yeah, great question. And I want to just start by saying that this looks different for everyone. So one size does not fit all when it comes to support. The first things that come to mind are having your trusted circle, whether that be family, friends, someone, I recommend if there's someone available that you trust, that they come to the doctor with you. Someone that can, when you're not in the mood or too scared or too ashamed to advocate, that person is there saying, okay, wait, no, actually what happened yesterday, or actually she hasn't been herself lately. I think that is so important, but I also recognize that there are a lot of immigrants of African ancestry who may not have anyone in the area and unfortunately could be dealing with this diagnosis. And for those, I'm saying it's even more important that they seek out support groups, therapists, someone who they can continuously be in contact with, who can be a support. Ideally, in those support groups, they can link up with another person who understands what they're going through. But it's so important to have someone and not be isolated and suffering alone.
Thank you so much. Over to you, Bonilyn. A question around this additions to support. So in addition to support, what else would you recommend to Black women who are struggling with their mental health?
Thank you so much, Dr. Maxwell, for that question. As a trauma psychotherapist, I know that trauma of any kind actually serves to disconnect people from themselves and their bodies, which can make taking care of yourself very challenging. Connection is the correction, meaning that connection to self and others is the key to mental and physical well-being. The well-known trauma psychiatrist Bessel van der Kolk wrote the book, The Body Keeps the Score. And the premise of the book is in the title, in that our bodies keep the score of everything that has ever happened to us. We know from physics that energy is neither created or destroyed, it's just transferred, including the energy of mental, emotional, and physical distress that can get locked in the body and lead to chronic physical illness and mental health issues. And so for all the ways that Black people have been traumatized throughout history, the approach to self-care and coping strategies for Black women needs to be a holistic one, ultimately focusing on the body, the mind, and the soul. Our bodies actually speak to us first, but we have to be connected to our bodies to know what it's saying. One of the group therapies that I facilitate is called Healing Through the Body, which focuses on understanding how trauma has impacted the body and teaching skills and strategies to reconnect to the body and in turn increase self-care. Some of the skills we teach, not just in that particular group, but throughout our whole program, include 5-sense resourcing, which is engaging your 5 senses to release feel-good hormones associated with relaxation and well-being, deep breathing to bring a sense of calm when feeling overwhelmed, for example, mindful meditation practice, which can increase body awareness and being in the present moment, foundational pillars of health, which includes proper sleep, healthy nutrition, and also physical movement, which is especially important to release stuck energy in the body. For example, Bessel van der Kolk has done several studies on the benefits of yoga for the treatment of trauma. Also, learning about how to have healthy relationships with yourself and others is a key focus in our program and has been proven to be associated with positive mental health outcomes. Spirituality and faith can also be very helpful for mental well-being. Emotional regulation and grounding skills is another area of focus that we focus on, which can reduce emotional distress and promote a sense of calm and balance. Challenging those negative core beliefs about yourself, others, and the world is a skill we teach to bring about positive changes in how you think, feel, and behave, as those are all interconnected. The importance of play and creativity is not to be underestimated and can also contribute to physical and mental well-being. And then finally, knowledge is power. There's a wealth of information and books on mental health and trauma, as well as specific books pertaining to the Black experience, which can be empowering. The more you understand about yourself and how life experiences have impacted you, it can put you in a better position to take care of yourself, decrease that shame and guilt that we've been talking about, and get the support you need.
Thank you so much for that very fulsome response. Over to you, Khalilah, for some perspectives on personal experiences. Thank you for being with us. We're wondering if you can share with us some of your experience around your cancer diagnosis and how it affected your mental health.
Absolutely. Thanks for this opportunity, everyone. As Dr. Clark mentioned and as Bonilyn mentioned as well, in the Black community as Black women, we are expected to carry the weight of the world on our shoulders, right? For me, I was the first grandchild. There was a lot of responsibility in my home. I was born in Jamaica, grew up in Jamaica. So a lot of the times we are sometimes become one of the caregivers of our younger siblings and cousins and all of that. And so, going through life up to that point, it was, suck it up, that's what we all had to do when we were growing up. It was, there was never an opportunity to kind of share how we're feeling emotionally. There was no room for, discussing our emotional health or our mental health. It was, you just survive, you just get along. And so I grew up not really asking for help and trying to do everything on my own, trying to do everything myself. And then some, right? Helping other people a lot of the times at the sacrifice of my own well-being. And so when I got faced with a cancer diagnosis and realized that my life was going to change drastically, um, I dealt with a lot of guilt. I dealt with a lot, as Dr. Crystal mentioned, I dealt with, did I cause this on myself? Was there something I did? And then, you hear people on social media saying, you can prevent yourself getting cancer, you can eat different. And I mean, all those things are important, of course, but it doesn't help to hear that you possibly did something to cause this on yourself. And then in turn, you're going to affect now your children and your whole family. So I dealt with that, but that space, that mind space quickly disappeared for me because of my faith. I realized that, there was nothing that I could have done to prevent myself from getting cancer. I didn't contribute to me getting cancer. I couldn't stop myself from getting cancer. And so I quickly dived into my faith. I used my church community to help me through that process. Thank the Lord, I had a really great husband who supported me and was there just trying to uplift me and made me feel like, I was just so protected, like a big hug. And then I had really, really great friends. Two of my high school friends from high school literally flew from the US to came and visit me. And that really boosted my self-esteem, my morale, the fact that I had people who supported me. And one of the things that really opened my eyes was that there were people who were afraid to call and talk to me because they were afraid of how I might sound. They were afraid of having the conversation of what I was going through. And that could have potentially led to isolation and feeling like nobody cares, nobody wants to talk to me. But that wasn't my experience. I had really, really great people, really great support system that came alongside me. And I intentionally made it a point to only surround myself with positive things, right? People who were positive, and I let it know through my my friends and family. If you're going to be negative, if you're going to say something negative, please stay away. I really don't want you to be a part of this journey with me at this point. And I said it out loud, and I think it helped me to get bold about talking about the type of care that I wanted for myself, the type of support that I wanted for myself. And throughout my entire journey, thank God, I didn't face a lot of depression that most people potentially face through this disease, because earlier on, I decided that that wasn't going to be my story. I saw the experiences of people not talking about their illness for that same fear of blame, shame, guilt, and they just didn't want to deal with the negative aspect of it. So they suffered in silence, right? I knew of so many women who I heard passed away through this time, and I didn't even know that they were going through this disease because they didn't talk about it. And when I found that out, I decided that that was going to change with me, if nobody else. I was going to talk about it to whoever will listen. If you don't want to listen, close your ears. And I was going to make it a positive experience of how I was able to go through this journey with the support and, of course, with my faith. So it was an intentional choice to not let those stigmas affected my healing and my treatment.
It's such an amazing story, and you really helped us understand how you navigated those challenges with all of those choices and those interventions. Thank you so much. I'm going to move over to Luana and ask you about what mental health challenges do you typically observe with your patients after a cancer diagnosis?
Yeah, so I would say it's common for patients to experience an initial shock after the cancer diagnosis, even if there is a cancer history in their family. It just takes time to make sense of diagnosis, and of course they can feel sadness and fear and guilt and anger, as some have already shared. Anxiety is also very common, just navigating uncertainty and unknowns that come with it. Making decisions may also feel overwhelming when you're already anxious, trying to absorb new information while attending multiple appointments, meeting multiple providers. And the cancer diagnosis also comes with a lot of changes, right? So changes in their health, in their body image, relationships, finances, and in their identity as well. So there's also grief associated with the losses and the changes and the transitions after treatment and during treatment as well. And it's been said as well, but the cancer diagnosis and treatment can also be potentially traumatic in itself. So patients can experience PTSD symptoms, and a lot of them struggle with the fear of recurrence, feeling often stuck after the treatment is completed.
So powerful. What do you find is critical for patients in navigating the life and treatment issues that they face after a cancer diagnosis?
I would say that having access to relevant information to help inform decisions is really important. Building trust with the healthcare team, which I know can be quite challenging. Prioritizing and attending to their own needs, which something has been shared before, something that's hard, but at the same time, very crucial. And really asking for and accepting help. And I know this can be a learning curve, as many women are more often than the caregivers for the children, for the parents, even for the spouses, regardless of age or of work responsibilities. But it's very important for them, especially at this time, to be able to access supports and resources and to really engage in self-care. And this may be the first time they are doing this more intentionally and mindfully. And supports in general can come from friends or family and healthcare professionals and community organizations as well. I think it's also important in managing expectations, so their own expectations or expectations of others around them of how they should be feeling or what they should be doing at that time, and really finding opportunities to slow down, ground in the moment, taking really one step at a time. Having a safe space to process their experience is really important if possible. And like it's been said as well, the peer connection that are very, very powerful, because I think it allows a unique opportunity to feel validated, normalized, and supported. It's also knowing that it's okay and normal to have bad days, and you can be hopeful and grateful at the same time.
Thank you so much for that response. Crystal, back over to you. Could you tell us a little bit about some of the main barriers that Black women face when seeking mental health care?
Yes, so unfortunately, there are many Black women face. Disproportionately, we don't have access to local resources. So location of mental health services can be a barrier, whether that's too far from the neighborhood that you reside in or too far from where you work. You're trying to get to an appointment from work, but it's inconvenient. You can't take that much time off of work for a 45-minute commute to the appointment and a 45-minute back and an hour appointment or a half an hour appointment. So that can be a major barrier. The cost of quality care. Currently in the Ontario province, many of the therapists are, who especially if they're psychologists, meaning PhD trained, and even those who aren't are out-of-pocket expense if you don't have, if you can't afford the out-of-pocket expense, or for those who do take a, insurance that's not OHIP, you don't have that insurance, then they are hard to access, and it's already a shortage of mental health providers, whether they're psychiatrists, psychologists, social workers as it is. So to have that further limitation, is impacting us all, but definitely disproportionately Black women. Another barrier is religion. Those of us who have strong religious faith might have been told by pastors that, just pray about it. Just, this somehow it's going to go away from prayer. And so religion itself can be a major barrier. But I would also say one of the many things that patients talk about is feeling culturally safe. We've heard from Khalilah and others that, sharing something so personal can be, and just feeling the guilt of even dealing with something like your mental health not being right can be very shameful. And then to have to go to someone who might not understand your culture and appreciate your race and ethnic background can be that much more, just discouraging, or, increase the likelihood that you just won't come. And especially, those who are Black are asking for Black psychiatrists and Black mental health providers. And I say, there's not enough of us. Even at Women's College Hospital, I'm the only Black psychiatrist walking around here. So we know we need more. And so I tell my patients all the time, and those who are seeking care otherwise, that, it's really about finding, even someone like Luana, who is, I imagine just from what I know of you, Luana, it's a culturally safe space. And so it doesn't have to necessarily be someone who exactly looks like yours, exactly your complexion, your race or whatever, but maybe it's another person of color. Those are really some of the main barriers. And it's unfortunate that we're still dealing with so many barriers today.
Yeah, that's so true. I think you've touched on some of these issues around stigma and cultural misconceptions around mental health within Black communities, affecting Black women's willingness to seek help. Any other messages that you might share with the folks that are listening tonight?
Yeah, I always bring it back to religion, because this comes up so often, and I feel like I have to go to the Bible with the patient to break down why they need to seek care for their mental health, or why continuing therapy or even taking a medication might be important. And often there's so much shame and stigma, but they'll say, well, I'm going to pray about it. I have faith, and I remind them that faith without action is dead. The Bible says that. And so it's not just, it's kind of like what we're talking about tonight with oncology treatments. It's not enough to recognize that something might be wrong. You have to actually take the action. It's not enough to just say, I'm going to pray about this lump in my breast. You have to actually go see the doctor and get evaluated. And that's the same with mental health. You can't just say, oh, I haven't been right. It's been weeks, it's been months, and I don't feel well. I'm really down. I'm really sad. I can't seem to get out of bed, and not actually go seek care and get treatment for it.
Thank you so much. Bonilyn, over to you once again. I wonder if you could tell us about what mental health resources or support systems are available or should be made available to help Black women cope with the emotional and psychological impact of these kinds of health issues.
Yeah, thank you for that. So I'll start with what we offer here at Women's College Hospital in our mental health department, which includes 3 sister programs, namely general psychiatry, which is for adults struggling with mental health issues, like any mental health issues. Then we have reproductive life stages, which is for women struggling with their mental health related to any stage of reproduction, and then trauma therapy. In the trauma therapy program where I work, we provide therapy to adult survivors of childhood interpersonal trauma, which refers to the abuse that occurs in the context of a relationship, namely sexual abuse, physical abuse, verbal abuse, emotional abuse, and neglect during childhood or adulthood or both. And the impacts of this type of trauma affects every aspect of life, leaving individuals in chronic states of fear and stress, which negatively impacts the brain and body, and in turn can have detrimental effects on both mental and physical health. So it's no coincidence that a high number of our patients also struggle with chronic illness and chronic pain. Black women in particular are carrying the multi-layered ways that Black people have been traumatized throughout history, such as slavery, racism, ongoing oppression, coupled with the ways women have been socialized in society to be the caretakers and put others' needs ahead to the detriment of their own, and therefore have been suffering in silence for generations, which makes physical and mental health struggles even more compounded and more complex. We know that people feel more comfortable accessing services from places where the people who work there look like them, which in turn can lead to better mental health outcomes. And so during the Black Women's Healthcare Summit back in the fall, I had mentioned that my team and I were thinking about offering one of our group therapies specifically for Black women run by Black therapists. And I'm actually pleased to announce that it has been approved by the hospital as a pilot project that will be coming soon. And the power and purpose of group therapy is to decrease isolation and not feel so alone in your own experience by connecting and relating to others who have experienced similar struggles. So I'm really excited to finally have a group therapy for women.
That's amazing news, Bonilyn. Thank you for letting us know that.
Yeah, thank you. I'm really excited about that. Yeah, so this will promote, healing and connection amongst Black women, as we've talked about, that, the shame and the guilt that really can be a barrier. Outside of our hospital walls, there are a number of Black-specific services actually across the Greater Toronto area. These include Delta Family Resource Center, Across Boundaries, Rexdale Community Health Center, Wanasa, and Substance Abuse Program for African, Canadian, and Caribbean Youth, just to name a few. The Black Mental Health Fund also has been operational for a few years and has fed into initiatives all over the country, which means a lot of organizations have or will have more and more Black-specific programming. Primary health care is of utmost importance as well. And so Taibu and Women's Health in Women's Hands are places that have wraparound support services and are Black-specific.
Thank you so much. Luana, I'm going to move over to you and ask you the following question around family members and what they should look out for, what approaches they can take to be supportive to a person receiving health news or a cancer diagnosis.
Yeah, so I would say, family members and close ones usually know the patients quite well, so they can probably, tell when they're really struggling, but some patients do avoid expressing their feelings to protect them. So common signs, I guess, that a patient may benefit from more support would be, changes to sleep or eating habits, and Dr. Crystal had mentioned that before, withdrawing, so isolating themselves or anger bursts, in terms of the treatment difficulty with decision-making or avoiding attending appointments or general kind of distress symptoms impacting general well-being. So they can express what they notice, right? Normalizing their feelings in the context of the challenging situation, which is the cancer diagnosis and treatment, and really reassuring that they're present with them, even if the patient they don't want to talk, right? So just opening that space for communication and offering even to facilitate access to services if it's something they're interested in, like discussing a referral to social work next time they come for appointments, or asking about resources available for from the healthcare team if the patient agrees, right? So I think in general, it's best just to follow the patient's leads in terms of not pushing too hard if they don't want to talk with others. Let's say you should talk to somebody who went through that. I know somebody who had breast cancer. Maybe they don't want to do that in the beginning, right? So just respecting kind of their timing, but really remaining available for support whenever they are ready, and again, keeping the communication open.
Thank you so much for that. Our last question will go to Khalilah, and hoping that you can share a little bit of your strategy that you found helpful managing your emotional and psychological health that came with your diagnosis during and after your treatment.
Thank you for that question, Dr. Cindy. So during my treatment, one of the things that I had to do was retrain my mind and retrain my thought process in learning how to ask for help. I'm usually the one that everyone comes to for help. And so I had to remember that I deserve help. I'm deserving of help, and that there are people out there that wants to help me, and there are people out there that wants to see me do well. And so I had to retrain myself to remove that. I guess it's pride, I guess, is one of the best ways I can explain it. That pride of asking for help, asking for someone to help you, because we're so used to, as Black women, doing it all and being expected to do it all, and carrying the burden. And there is somewhat of a pedestal and of a kind of praise for women who do 10 million things, right? Oh, look at her. She's doing so well because she's doing this, she's juggling that, not realizing that a lot of the times we are doing it as a detriment to ourselves. So throughout my diagnosis, I had to retrain myself of how to ask for help and how to accept help. That was a big one for me because I'm not used to accepting help from others. And so I had to learn to do that. And then after my treatment, I had to learn to love my body in a new way, because now I didn't have my breasts. And one of my treatment as well was going through a full hysterectomy. And so all the things that I thought identified me as a woman were no longer a part of my body. And so that did bring some stress and some anxiety. And so I had to learn, when I look in the mirror and see my new body, how am I gonna love the person that is looking back at me? Because I had actually considered my breasts to be one of my best physical assets, and now they were gone. So, and what does my husband think of my new body? Is he going to love me the same? And so going through all of those psychological thoughts and negative thought process took a lot to really remind myself that I'm alive. That's the biggest thing, is that I'm still here, and that once there's life, I will get through it all. And, and just really talking. One of the big things for me as well was just speaking, opening myself up when I feel a certain way, when I feel like my mind is going crazy, is just allowing myself to call a friend or talk to my husband about it. And I love Dr. Crystal comment about, praying and saying, oh, just pray about it. It'll go away. No, it doesn't go away. And so having positive people that is have your best interests at heart and is there to support you is good, to just open up and talk to them, and finding that those people that you trust, having that inner core circle of 2 or 3 people that you trust with your life, that they're not gonna go out there and tell you and be critical of you, but having those core people you can go to and talk to. And I still practice those things today, and I'm almost 8 years in remission. So those are the things that have helped me.
So amazing and inspirational. Thank you for that. Deepest gratitude to all of our panelists for sharing their experience and their expertise. We're going to move to the questions now, and such amazing and interesting comments and questions from our listeners tonight. I believe the first question I might direct to Crystal, if that's okay. And this is around what advice you might give to policymakers regarding mental health in Black women.
Yes, so I will first step back and say that we have to first better understand the needs of our Black women by doing research and having initiatives about characterizing the disparities and equity gaps around, whether that's cancer, mental health, what have you, any of the medical specialties. And in addition to that, the things I see every day that really get me are that we don't have insurance coverage for enough of our allied professionals. And a lot of our Black community, Black women are working with those professionals. They feel comfortable, they trust, they feel safe with those professionals, but those professionals can't refer them to me. And that's a problem. those professionals also may not be covered by insurance. So insurance coverage for those professionals would be amazing. But also, even in my doing a lot of work with reproductive psychiatry, midwives, for instance, can't refer to me either. And so many people do not have family doctors who can refer. And so it's so important that we change the policy so that the access or the gateway, so to speak, to receiving mental health, to getting even a referral to get to that mental health professional is open, wider. I would also say that we got to incentivize all the folks that are going into private practice. I totally understand. It could definitely be more lucrative than being in academia, but we got to have some policies that incentivize them to help patients who, can't afford to pay out of pocket, because we have such a mental health professional shortage that without expanding and broadening our reach, we have so many patients suffering, so many people who, even if they can get over the hump of the shame, the stigma, then they still can't reach the resources.
Yeah, absolutely right. Let's team up and work on these changes that we want to see going forward. This question I think might ask you, Khalilah, if you would be willing to answer, and it's around other techniques for self-help or ways that you can take care of your mental health. Do you have any other suggestions?
Yes, I think it, as a speaking from a Black woman's perspective, is we have to first acknowledge the shame, acknowledge the stigma, acknowledge all the things, all the trauma that we grew up with. I know for me, for a very long time, I buried a lot of the trauma that I experienced as a young person growing up. And not dealing with that trauma when you're faced with an illness like cancer, it can, as Dr. Crystal says, and Bonilyn has said as well, re-trigger some of those things. And until you acknowledge and deal with it, it's going to be much harder for you to go through another life-altering trauma that you're gonna walk through. So I think for me, I had to come face to face with a lot of things that I didn't deal with growing up, and having a lot of time when you're laying down and not being able to move. Of course, your mind starts to think and wonder, and so a lot of it came flooding back, and I was forced to confront those things and really face them head on. And one of the things that I learned to do was to forgive myself for some of the blame that I was being placed on myself, and some of the critical things and hurtful things that I did to myself. And so I had to ask for forgiveness from myself for those things. And and as a parent, there were a lot of things that I blame myself for as well. And so it was learning a new way of communicating with my children, not to go down the same path of how I grew up, as not being seen and not being heard, and just kind of being brushed aside, and allowing my children to have a voice where they could speak to me. And that really helped my mental health, and also built my relationship, especially with my daughter as well. And some of the things that I was teaching her by my actions, I allowed her the space to come and have those conversations with me so I could have those discussions with her. And it really, truly helped in my healing and helped in my relationship with my children. And that was one of the biggest inspiration and source for me deciding that I was not going to let this disease take my mind and take my health, was my children. And so having those opportunities to be able to mend relationships with my parent, with my mother and my family, and then pass it on to my children was very, very helpful. So hopefully that helps somebody.
That's amazing. Thank you for sharing your strength with us. Next question, I think maybe Bonilyn, I'll ask if you can answer this one. It's around an occupational health perspective and what we can do best to support employees, people we're working with who are going through these challenges.
Yeah, I mean, employees also, will struggle in their own ways and, have their own issues, their own families, and be caretakers or all of that, working in a predominantly women-centered hospital. Most of our employees here are women, but are also mothers and wives and caretakers and, caring either for their young children or also, also probably their elderly parents. And so it's so important to recognize just the needs that employees have. So having initiatives around health and wellness, and being able to take mental health days, because self-care is so important. Like it's actually an ethical requirement for the practice of psychotherapy to engage in your own self-care. So it's not just something that we preach to our patients to engage in self-care. It's actually something that we have to practice ourselves, right? So it's not just talking the talk, it's having to walk the walk. And so if organizations can really get on board with the importance of keeping their staff like healthy and well, and understand how much physical and mental health are interconnected, to have more of those initiatives, I think would just be so much more important. And to have perhaps even more benefits for mental health resources, right? For seeking therapy and all of that. There's not a lot of organizations have a lot of benefits set aside specifically for seeking your own therapy, seeking mental health resources. And so increasing that, I think, would be tremendous. So I would really like to see change in that department for sure.
Absolutely. I think this has come up a few times now in our panel Q&A, issues around access, who refers, how do you get referred, etc. So I might ask the last question to Luana, if that's okay. And could you just share with us your perspectives on how people access mental health counseling, and some of the best ways to go about doing that?
I would say for the cancer population specifically, most of it would be at the hospital with social workers or psychiatrists, so asking for a referral at any time. So it can be at diagnosis, during investigation period, or even after treatment, years and years after treatment, depending on what kind of team they have available at the hospital is something that could be available there, or in the community as well. There's specific communities providing supports, like support groups. Sometimes they do offer one-on-one supports for patients going through that experience, and caregivers as well, family members, children impacted by cancer. Or if they have the means to afford privately, there are specific ones that they are geared to oncology and kind of looking at those specific issues and helping them through it.
Thank you so much. We are so indebted and grateful to all of our amazing panelists this evening for sharing their expertise, their perspectives, their guidance around the challenges in mental health in Black women, as we come together to talk about cancer in our Black communities. So deepest gratitude, and we will conclude this panel and go back to Elaine.
Thank you to our panelists for your time and your expertise, and especially to Khalilah for your grace, your strength, and your courage, and for highlighting that having a cancer diagnosis is not a death sentence.